歡迎大家嚟到今日。
Welcome to the press briefing today. With us are Dr. Chang Shuk-Kwan, Head of Communicable Disease Branch of the Center for Health Protection, and Dr. Sarah Ho, Chief Manager, Hospital Authority. Dr. Chang will first brief us on the cases. Good afternoon. As of last night, we had 131 newly confirmed PCR positive cases, including 28 detected by the Hospital Authority, 18 detected by the laboratories of the CHP, and 85 detected through private laboratories. Another 149 cases tested positive by RAT, so the total number of positive cases today is 250. As of now, since the fifth wave started, there were 1,194,740 positive cases. 747,301 were PCR positive cases and 447,439 RAT positive cases. For 53 positive cases, we carried out preliminary genome testing. 52 tested negative to the L452R strain. For one of the cases, the viral load was too low, so result was pending. Of the cases today, there were 52 imported cases. 10 were detected through RAT, 16 were detected at the airport. 8 involved passengers who arrived yesterday, and 7 arrived on the 9th of May. Another 16 cases were detected at hotels on day 3 to day 6. Of the cases detected at the airport, of the cases yesterday, 6 flights were involved. JL029AI 314 2 cases, SQ894 2 cases, EK384 1 case, KE607 2 cases, and 5J272 1 case. There were 7 cases who arrived 2 days ago, including QR8183 cases, TK0833 3 cases, CX1041 1 case. For residential care homes of the elderly, there were no recent infections. Among schools, 3,509 schools resumed lessons today, including some 750,000 students and 150,000 odd staff members. There were 24 positive cases, including 18 detected through RAT and 6 through PCR tests. Of the 24 cases, 23 schools were involved, involving 15 students and 9 staff members. In one of the schools, there were 2 students who tested positive coming from the same family. Of the 18 positive RAT cases, 17 were tested today and 1 tested positive yesterday. Of the 6 PCR positive cases, 1 of them provided a sample yesterday. The rest provided samples earlier, and we received the results today. The 24 positive cases include 3 from kindergartens, 14 from primary schools, and 17 from secondary schools. Like I said, in one of the schools, 2 students came from the same family, and over the past 7 days, another 3 schools recorded 2 cases each, and according to our preliminary investigation, they were not in contact with each other, so apparently they were unrelated. For fatalities, DHA reported 3 more deaths. So far, the total fatality is 9,064 deaths, including 70, and for the 78 reported from outside of DHA, the total is now 9,142 fatalities, including 3,771 females and 5,371 males. The crude fatality rate is at about 0.765%. As for the breakdown among the vaccination and unvaccinated, the trend is similar as before. At the Peony Golden Court hot pot restaurant in Yuen Long, we have managed to trace down all the customers, we identified 3 more patrons who started experiencing symptoms from the 2nd to 4th of May. They were tested on the 8th and 9th of May, and the results were positive. They were aged 71 to 76 years old, and they dined at the restaurant on May the 1st. They had mild symptoms. A total of 20 diners who visited that restaurant have tested positive so far. And there is a member of staff plus 2 close contacts who also tested positive. The onset of symptoms started from the 3rd to 8th of May. Many had no symptoms or they had mild symptoms. We trace all 190 odd diners who visited this restaurant. 3 of them are currently not in Hong Kong. 1 is in the mainland. Another visited another place. We have informed the relevant healthcare units to see whether any follow-up is needed. That's all for my report today. Dr. Ho will brief us on the situation at the HA. Good afternoon. Currently, 892 confirmed patients are staying in our public hospitals, the North Lantau Hospital, Hong Kong Infection Control Center, and the HA Infectious Disease Center. Yesterday, there were no newly reported patients in critical or serious condition. 3 patients in critical condition are staying in our ICUs. And like we said, 3 fatalities were reported. 1 was a 90-year-old male patient who passed away on April the 20th. The other 2 patients passed away yesterday, including 1 male and 1 female, aged 68 and 86 respectively. Of the patients who passed away yesterday, they were both elderly people above the age of 65. No patient came from residential care homes. Both received 2 doses of a vaccine. 130 patients recovered. 87 have been discharged since the 5th wave started. 49,056 patients recovered. 48,461 have been discharged. Since the start of 2020 in Hong Kong, a total of 61,436 COVID patients recovered, of which 60,841 have been discharged. Today, no patient or staff member has been listed as a close contact due to admitted patients. A total of 22,661 HA staff members were infected. 22.52 thousand have returned to their posts. All along, the HA has been keeping tabs on the development of the pandemic, and we have constantly adjusted our services. We understand the demand on general outpatient clinic services, and in light of the recent developments, the HA would suspend the services at the designated clinics in phases, and GOPC services would resume gradually. Earlier, certain service hours at GOPCs have resumed, and 8 designated clinics will suspend operation tomorrow, and upon complete disinfection, 2 days later, we would resume GOPC services. At the Qingyi Cheng Hong GOPC, nighttime service would resume the same evening. For the remaining 15 designated clinics, they will continue to operate to take care of the needs of COVID patients and their family members. They may call the designated clinics or use the HA Go mobile app to make service bookings. We will continue to monitor the and service demand, and as face-to-face lessons resume at schools and social distancing measures are relaxed by the government, we will continue to monitor the situation, and based on actual need, we would adjust service provision. including the GOPCs and specialist outpatient clinics, and services will be provided for needy patients. For the list of 8 designated clinics which would cease operation, we have shared a list with the media already, and you may refer to our press release for details. Thank you very much.
Now it's question time, so please tell us the institution that you're representing. I'm from Cable TV. First question. 1.5 million people have not taken their first jab, and at the end of this month, the third phase of vaccine pass will start. So does CHP think this is a huge number? Do you think there are still a lot of people that still have not taken the jabs? Do you think the third phase should be postponed? How can you push the inoculation rates? Another question is about Peony Golden Court. You say that one customer has gone back to the mainland. Where has it gone to? And there are 3 additional cases concerning Peony Golden Court. How many of them are close contacts? And some of them waiting for test results. And now there have already been 10 days since the outbreak. If these people are moving around in the community, have you been tracking them? Well, if they do not know that they are confirmed, do you think there is a risk of them infecting other people? And it has taken 10 days for you to trace all the customers. So have you encountered any difficulties, CHP? As for vaccination, of course, we encourage people to take their jabs as soon as possible. If you have not taken vaccinations, please do not visit restaurants at the moment. And for the 3 customers, one of them has gone to Shenzhen, and now he's under quarantine. And for the other close contacts, we haven't found any confirmed case yet. Well, of course, there's an incubation period, and there may be new cases. But these are household close contacts. And for every day, we have 200 to 300 cases. As for the first, when we knew the first case, I think it was the 7th or 8th of May, it took us 2 to 3 days to trace all the cases. We didn't spend 10 days on that. And for our case tracing this time around is easier because we have vaccine pass and it's quicker to find their telephone numbers. And for an outbreak like this, well, because Omicron is very infectious, so we cannot find out there's an outbreak immediately. Maybe it will take a few days for us to find out that there's actually an outbreak. This is the characteristic of Omicron, and there are restrictions. So at the moment, well, patients may not know that they have been infected, and they may infect their family members or their close contacts. So if it's their family members or it's people that have news of them, these people would have to be quarantined. I'm from Hong Kong 01. I would like to ask Peony Golden Court, the cook is confirmed. And how about his colleagues? They are not confirmed. And if the cook works for a long time in the kitchen, does CHP think that he's infected in the restaurant or he's infected in the community? And yesterday you mentioned special testing for care homes, and 3,000 samples have been taken, and 20 to 30 of them are positive cases. So will you assign them with case numbers? And after the operation, will you tell us how many of them are positive cases, and will this affect the total tally? As for Peony Golden Court, we haven't found any other staff members that are infected. Well, if we look at the 1st of May, then actually most of the cases should have been confirmed. Now, because that cook was there on that day and he took breakfast there, so maybe he was infected at that time. But we have to look at the genome analysis. And we have just gathered the samples of the 20-odd persons, and we are telling our laboratory that comparisons have to be made. As for special testing for care homes, because each day there are not many cases, it's about 200 cases, so they are already included. And if it wasn't a confirmed case beforehand, well, if it was a confirmed case beforehand, we will give it a number. I think 3,000 odd samples have been tested, and it's from 2,000 plus people, because some of them may be retested. And as of today, there are 5 cases that have been included. So I think in total there are 30 plus cases. Next question. I'm from Orange News. I would like to ask about the trend of the epidemic. Dr. Zhang said that if people do not wear face masks, then they may expect to be infected. Now the government is going to relax more social distancing measures. Do you think that the epidemic will rebound? And is this within the expectation of the government? Are you still aiming at the goal of 0 cases? And now there will be a 3-month grace period. Do you think this is necessary? And for the Peony Golden Court restaurants, you told us that 3 customers are not in Hong Kong. 1 of them has gone to Shenzhen, and where have the 2 other gone to? Yes, 1 has gone to Shenzhen, and the other 2 has gone to Malaysia. As for the second phase of measure relaxation, well, it's about social distancing, relaxation. There are more people going to public areas, and there are more person-to-person contacts, and people may take meals together. We know that the characteristic of Omicron hasn't changed since the beginning of the 5th wave. It's a very infectious virus, and under many circumstances, people can be infected. But over half of our population has been infected, and many people have taken their 3rd jabs. So they would have a stronger resistance against the virus. And even if they are infected, the symptoms will be mild, and serious or fatal cases would be less. So we encourage people to take the 3rd jab, and if you can take the 4th jab, please do so. And there are more people flow, and of course there will be more transmissions. Well, a lot of people may already be immune to the virus, or they are now protected by the 3 jabs, so the infection rates may be lowered. So there may still be the possibility of rebound. As for vaccine pass, I understand that the government has a timetable, so I'm not going to supplement. I'm from Economic Times. I would like to ask about the Peony Golden Court restaurants. How many tables are involved, and where do the customers sit? Are all of them sitting in the middle of the restaurant? Do you think a certain infected person is big spreader? And you have not identified all the customers yesterday. Today you have traced all the customers. So how do you do that? So for the Leave Home Safe, I don't think there are telephone numbers on them. So how do you find their telephone numbers to contact them? And I would also like to ask about schools. You said that there were 3 kindergartens, 14 primary schools, and 17 secondary schools, and there are 24 positive cases, and there is a total of 34 schools. So do these numbers tally? Let me check again. As for the restaurant tables, we think that 5 to 10 tables are involved. It's a bit complicated because a lot of elderly persons would visit the restaurants, and they may not know each other, and they may sit at the same table. So they may be sitting to people that they do not know. So even if we ask them who are seated next to them, we may not be able to find the customers. Well, of course, couples may visit the restaurants, or a family may visit the restaurants. They know who's sitting next to them. So most of this table are in the middle of the restaurant. Some are more towards the right-hand side.
In terms of schools, perhaps I made a mistake. there were 5 students from kindergartens, 9 students from primary schools, and 10 students from secondary schools. Oh, that's a total number, including students and staff members. 5, 9, and 10 people from kindergartens, primary, and secondary schools, respectively. When you enter a restaurant, your vaccine pass would be scanned by a scanner, and the scanner would access your vaccination record. And in turn, one can trace your phone number from the vaccination record. Next question, please. This is Ming Pao. For the Yuen Long restaurant, Dr. Chang said the distribution of tables was rather complicated. We would like to ascertain the layout of the tables. How big was the area occupied by these tables? Do you believe that airborne transmission over short distances was possible? And according to experts, do you see substantial risks arising from these cases? What is your assessment of the risks? And I have a question for the HA. For the general outpatient clinics, what are the criteria used in assessing the general outpatient clinics to be reinstated? Some social workers or NGOs told us that demand for GOPCs is particularly high in certain districts. You said that over the past 7 days, some schools saw more than one case. I'd like to know the exact breakdown of schools by the number of cases each. You said there might not be a direct relation between the infected cases. Does it mean that they never met each other, or they simply went to school on different days? For the schools, we would see whether there were multiple cases from the same school over the past 7 days. Over the past 7 days, there were 4 such schools. 1 was reported today. 2 students came from the same family. For the remaining 3 schools, the students and teachers who tested positive had no direct relation or contact. So transmission within the school is unlikely, in our opinion. At the end, we still see a lot of infections in the community, and some people were subject to compulsory testing, and they provided PCR tests. For the restaurant in Yuen Long, there were more than 30 tables at the lobby or the ground floor. Most diners sat in the central area or a bit to the left of the center. So it was likely that transmission took place on the 1st of May, and the transmission was likely to be airborne over short distances. We are constantly keeping tabs on the pandemic, and we are also monitoring the public demand on GOPCs. Face-to-face lessons have resumed at schools, and social distancing measures have been relaxed by the government as well. And that is why it is important for us to strike a balance between addressing public needs for GOPC services while monitoring the pandemic and the needs of COVID patients in the community. So we will continue to adjust our services based on need. Final question for the day. This is TVB. You said 2 diners went to Malaysia. In other words, they had a negative test result before they boarded a plane. did you identify any super spreaders in the hot pot restaurant cluster? We saw many instances of positive sewage testing samples, and with the daily caseload at about 200, do you feel that compulsory universal testing should be carried out right now? I'm not sure about the Malaysian requirements for inbound visitors. If a negative PCR test is required, then I believe they would produce that before they boarded the plane. And the same goes for the mainland. At the border, one must conduct or take another test, but we do not know what the latest test results for those passengers were. We were yet to identify any super spreader. Even if a super spreader led to infections in a restaurant, then well, it's likely that he or she would infect household members as well. In terms of sewage surveillance, we are looking at the distribution of cases in the community. So in areas with a high viral load, specimen bottles would be distributed and lockdowns might be ordered. This is the end of the press conference. Thank you.